Today we will be discussing reactivating patients. We not only want to focus on obtaining new patients, but we want to value the relationships already established. It is important to consider the facts. When you consider that it costs 5 times as much to attract a new patient as it does to keep an existing one, it becomes very clear that investing time and effort in a patient retention strategy is far more than just a good idea. It's a great idea. There's many times where we're missing the opportunity. Many times practices are missing a critical opportunity to increase production without adding a single new patient. It is important to establish a step-by-step system to re-engage patients who have not been seen in a significant amount of time. You do this by following a simple step-by-step system that will increase production significantly. This can be done through a simple phone call, text, or email. These will provoke the patient to make an appointment and will not only lead to higher production, but also create value and demonstrate that you care. Step 1. Identify who is overdue. Team members should generate electronic reports via their dental software. This is very easy to generate these reports. It's just important to know how to do it. In these reports, you'll be able to tell who is overdue for recall appointments, who has unfinished treatment or outstanding treatment plans, and who has unaccepted treatment plans. Step 2 is making the calls. You want to have a staff member with excellent phone skills begin making those calls. Start with patients who are most recently overdue. And then calls should be made when schedule allows patients to get an appointment in a timely manner, typically less than 2 weeks. Make calls during times that a patient would be most available, during their lunch hour, early evening, or maybe on a work phone that the patient gave us as permission to contact them. We want to use a script that ensures efficiency and uniformity. For example, "Hello, Mrs. Jones, how are you? We're reviewing our patient charts and noticed that you are overdue for your hygiene appointment. It's been more than a year since we've seen you last. We have an appointment available for you on the 26th at 11 a.m. or the 28th at 2 p.m. Which would work better for you?" Or another alternative would be, "Hello, Mrs. Jones, this is Betty with your dental clinic. We are contacting you as we have not seen you in our office for a while and noticed you have some dental work that needs to be done. We value you as a patient with us and would love to get you set up for an appointment at your earliest convenience. What day and time works best for you?" So then what do you do next? If the patient agrees, schedule the appointment as soon as the schedule allows. Now, if the patient declines, which will happen, then you want to let them know that you'll document this conversation and we'll make sure to give you a call at a later date and check in with them to see if they're ready at that time. Always make a note in the patient's computer file. Make sure to document. We want to know what was said during the conversation, the time of day you called them, and how you ended the conversation. That way you can always look back and see so that when you make future calls, you have it documented. Step 3, sending letters. Even after phone calls are made, it is okay to still contact the patient via mail or email. Maybe send a direct letter to every adult in your active and inactive files who is or was a good patient in standing. Some things to include. Maybe importance about ongoing professional dental care. Also, take the opportunity to educate patients about new techniques and procedures available in your office so that they can achieve that beautiful smile. Continuing education programs you and your team have completed. New benefits that you might be offering. And if you're sending to families, include information appealing to parents' desires, such as providing the best care for their children. Step 4, deactivation. Sometimes, despite a team's best efforts, a practice must deactivate a patient based on the response they receive. There's different reasons. Maybe the patient indicates they are being seen in a different office. Patient indicates they have moved or relocated. Or maybe some family health issues, some deceased or other occurrences. In that case, it is important to follow a good script. For example, "Thank you, Mrs. Jones, for this information. We are sorry to hear we will no longer be seeing you, but trust you have made the right decision for your future needs. Please let us know where you would like us to forward your current records. Please do not hesitate to call us in the future if you have any questions or need further recommendations. What we have discussed is essential for your practice. Activating overdue patients is an essential step in that direction, and it has proved that practices that do this routinely will maximize their production potential. Follow these 4 simple steps, and I guarantee you will see the results. And also have team goals set up for your team. Making daily patient contact is priority. Assign a team member that will make those specific number of calls to past due patients a day. Schedule a specific number of appointments and ensure a specific number of patients completing treatment. Goals are necessary. Keep the goals aware for all the teammates so that they know what needs to be done each day.